So if you didn't come to the other 5, you've come to the best one, I am sure already. This one deals with the issue of cost of corruption, and the questions that we're going to be asking this evening, moderated by Renee Gamau, who many of you know from Capital Breakfast Show on Capital FM. Can we have a round of applause for that show? Okay. I'm just checking, Renee, whether we've got lots of nation people in the audience. But obviously, I think you're among friends. So we're going to look at what is the lack of accountability, diminished integrity cost us in terms of quality health services. And as we focus on the value of integrity, and as we begin to look at how we can reduce the level of impunity, we hope that we will be able to come up with some strategies that citizens can also use, and also support those who are on the stage, who are public officials and state officials, how we can support them to be able to protect taxpayers' monies. Let me then, with no further ado, invite our moderator for the evening, Renee, to take us through and to introduce our various guests.
Good evening. Okay, so this is participatory. As you know, when I'm on radio, I never get to hear anybody's voice. So this is my one chance to make people talk to me. So you will have to be a little bit engaged this evening. Good evening. Ah, there you are. My name is Renee Gamau, as you heard, and I am one of the 2 hosts of the Morning Drive Show on Capital FM, Capital in the Morning. This evening is all about health and corruption. Let's dive right into it. This evening, I would like to introduce you first to our panel. The very first one is to my extreme right, Dr. Mwachonda Chibanzi, did I say it correctly? Yeah, Chibanzi is a National Executive Council member at the Kenya Medical Practitioners and Dentists Union. Mr. Edward Oko is the Auditor General of the Republic of Kenya. Mr. and Senator Mutula Kilonzo Jr. is a senator in Makueni County, and we have an empty seat, which we have chosen not to remove because we still hope that Dr. Khadija, the Principal Secretary, Ministry of Health, will be with us. But if she is not, we will keep the space there in her honor. So a round of applause first for our guest this evening. So here's one of the first things that I found out when I started reading on this subject. The Auditor General is actually not very sure how much money was released to the Ministry of Health. That would be something that would be fairly straightforward, wouldn't it? And yet there are conflicting reports about exactly how much money was released. Whatever was released, here's what is even more alarming. It is not all accounted for. Now, the numbers that are bandied are numbers like 8.6 billion, which we have now come to relate to teachers' pay. Let's see, how many times would 8.6 billion shillings pay teachers for a year? And we can all do the math. But more importantly than the math is what it costs in terms of lives. We're celebrating, on the one hand, the creation of level 5 hospitals at each of the counties. However, if the hospitals do not have drugs, if the hospitals do not have personnel, if the hospitals do not have equipment, if the hospitals are not backed by primary health care, then we've got beautiful structures, great equipment, and not much else. But we want to have a conversation that is beyond just what's going wrong. We want to have a conversation this evening, with the permission of the gentleman, about what we can do in our little levels, from wherever it is that we are, to maybe better the situation, or to contribute towards our own healthcare. Because at the end of the day, it is you and I, and it is your grandma in Shags who you are sending M-Pesa so that she can get on a boda boda and find her way to a level 5 hospital that does not have aspirin, but suspiciously that the pharmacist knows exactly which pharmacy around the corner she can buy government stamped aspirin. If Kemri cannot account for the monies that have already been dispensed to it, listen to the reaction of Kisumu Senator Anyang' Nyong'o in response to this particular report.
Every month, the salaries alone of people who work in this institute of CDC Kemri here in Kisumu is 90 million shillings. That is a hell lot of money to lose in the county. And people who have been putting their hands into the till and stealing research money, they should deal with by the law. And I think CDC is right to put their feet down and say, look, if you bring our money, we want to make sure that that's what we bring it to do. About 11 counties are affected by the program here. My proposal to CDC and to Kemri, if you don't want to work with CDC, back off. Let CDC collaborate directly with the Jaramogi Oginga Odinga Referral and Teaching Hospital. There can be a collaboration between CDC and the hospital directly so that the work on health goes on.
If you did catch the gist of it, it was 90 million. It was salaries of a vast number of men and women who are hardworking, who are honest, and who are serving the communities in Kisumu and in Western Kenya. But more than that, it's the lives of the people whose research, whose medication, and whose healthcare treatment are affected. On that note, let's get underway. With the kind permission of the gentleman in front, they have allowed me to call them by their first name, so I shall do exactly that. Eddie, how much money was given to the Ministry of Health by the Treasury?
Our financial system is based on what we call a budget. So come beginning of, and our financial year runs from 1st of July to 30th June. By 30th, when we are finishing the year's budget, there is a new budget which is approved on 1st of July, which is approved by Parliament, and which has been discussed where the Treasury clearly indicates what is approved budget for each ministry. In financial terms and in layman terms, it's like if you are opening a bank account on the 1st of July, you would be given that budget as more or less a line of credit, which as you have activities to undertake, you draw it down. You know, you go and take 10 million, 1 million, and you draw it down. And given that you are drawing it down and accounting for it in a system which is integrated, you should be able to account for every single money you draw down, such that at any point in time, you can actually close the books and say, the budget is so much, yeah, what I've recorded in the system has drawn down is so much, and that agrees with the books. And what is still available is so much, or what I have the commitment is so much. So at any point in time, there should be a reconciliation, which should agree, basically rooted on what you would have processed through IFMIS.
And yet, for the year 2013-2014, you provided an adverse audit opinion for the Ministry of Health. Explain just very briefly what an adverse audit opinion means, and then why you provided that.
I think, let me put the classes of issues about my responsibilities, and the ministry or the client would prepare books, accounts from books of accounts. In other words, it's accounts which are supposed to be in the first instance agreement with all the transactions you'd have recorded during the year. So come the closure of the year, say 30th June, you take all the balances and then compile them into what you call a statement of accounts, which basically should show what the appropriations were, what was approved, and how you used it, and if you bought some assets, where are these assets, and if you incurred any liabilities, why and where are those liabilities. So those are the things which I'm supposed to come at the end of the year and say, give an opinion. So my opinion varies are categorized as follows. There is where I say it is unqualified opinion. In other words, I don't have any issue with the account. I can say that those accounts have been prepared from known books, known records, known system, and those accounts are in agreement with the system as they should be. So there is no problem. That's unqualified. Then the second level, although I might have seen all the records and agreed the amount, there could be some minor differences. Like you can say there's a difference which was there between this book and the figures, and you can say that it was money, maybe something in transit, something we are not recorded, which you missed. I can say, by and large, I don't have a problem with the accounts. And I would say, except for these minor issues, the accounts basically reflect materially what should be. So that's the second drop down. The next drop down is an adverse element of that. In other words, the accounts are there. I can see figures prepared, but I have so many disagreements in the figures and so many material amounts which are not explained to the satisfaction, which then makes me believe that these accounts do not actually show faithfully what the books of accounts should have produced. Then the worst one is where I simply cannot give an opinion. Now that one is very serious. It means that throughout the year, no record has been kept, and that no records have been kept. In other words, you've not even recorded anything which I can call as a balance to show that the balance today is this. There is nothing. In fact, I have no basis at all to even give an opinion. The opinion just basically says you have not produced any accounts which I can give an opinion on. And that is serious. That means it's shambles. There is not even books of accounts which are proper and which, and the accounts you presented, there is no basis for which I can audit them.
Sounds like Judge Kriegler.
Yes.
It does sound like the critical
Right. So a disclaimer, when I disclaim, is I have a serious misgiving about the management of the accounts, about the system of the accounts, and even the figures you're saying, even the assets you're saying you own are not, I cannot touch them.
So what report what was your opinion in relation to 2013, 2014?
I think in this case they were adverse. In other words, although I could see records, there is some material amounts which maybe I would say I don't see adequate supporting documentation. You get, so that's adverse, and the amounts are, if it is one, I might say, okay, it's except for this one, you know, they're okay. But when it is adverse, it means the amounts are material, which I either didn't agree with what you said, what the transaction should have recorded as being, or it simply, I didn't see justification for a lot of the amounts which I see in the books.
We shall hold that for a minute because I want
Yes.
to draw the senator in. Health is one of the functions that was devolved to critical, dare I say, to critical acclaim. Some of the counties saying we're not ready, we haven't budgeted, we are not ready to have health as a devolved service. Others going right ahead with devolution. Do you think we should have devolved health, looking back on what has unfolded within the counties?
Good evening. I wanted to say that I always admire people like her who speak on radio and crack jokes and laugh on their own, so it's a pleasure. This is, I'm not sure I know of any county in Kenya that has said that were not ready for devolved functions of health. The correct position for everybody to understand is this, is that the function of health has been devolved to a percentage which we have carried out. It's about 93%. The 7% that is left is the procurement of supplies of medicines, which is done by KEMSA. But it's fair also that Kenyans understand that your new constitution under Article 186, particularly 2, the health function is, we actually call it a concurrent function. So it's both done at national level and done at county level, because the two referral hospitals in Kenya, the one in Eldoret is in a county, isn't it? The one in Nairobi is in a county of Nairobi, but it is managed by the national government. Now, 50 years after independence, this question should actually be asked not of the politicians, but of the people who are the consumers of this service. As far as I'm concerned, the health sector is sick and has been sick until devolution. And therefore, we are of the view that at the time that you are devolving this function, the function had collapsed almost to totality. So therefore, it's not a question as to whether or not the devolution of the function has caused the problems that we are having. The problems we are having in the health sector have been there and have been caused because the people who are running this function are withholding funds. And I want to give an example and to answer the question of how much money has been given to this function. Last year, the money that has been allocated to the national government is 46 billion, 46 point something. This financial year, the national government has received 57 billion shillings. Out of that 57 billion shillings, 34 billion has gone to the ministry headquarters, and the balance has gone to the other three functions, which includes KEMRI, which includes, I can't remember the others, but that's how they have split the money. 30 billion has been allocated for capital expense, the rest has been put under recurrent. This financial year, the Senate and the National Assembly engaged in a cat and mouse game about the function, the money that should go to level 5 hospitals. For those who do not understand what level 5 hospitals are, what used to be the provincial hospitals, they are now called level 5. The money that has been allocated to those level 5 hospitals, and there are 11 in the country, is 3.6 billion. Now, if your constitution says you devolve a function and then you devolve the funds, there are no prizes for people to guess whether or not that function has actually been devolved, because the national government is keeping the bulk of the kitty, yet when they stand in public, they say we have devolved 93% of the function. So I hope I've answered your question. The devolution of health has been done on paper only. And therefore, when I say the health sector is sick, I mean it's sick because this central government is still withholding funds which ideally they should be giving to functions. The Ministry of Health headquarters and the functions that have been left at national government is to do policy. So why should you be giving 34 billion shillings? There are counties up to 2013, including Jaramogi Referral Hospital, that is having quarrels with national government because they were supposed to get a refund of 55 million. That money has not been released. Now, whilst this financial year we have budgeted 19.9 billion, and I want all of you to understand that we disburse funds in two categories. There's a shareable revenue, which is split amongst counties. This year is 286 billion, and then there's a conditional grants. Now, conditional grants this financial year is 19.9 billion. It includes free maternity care. It includes 4.5 billion of this controversial medical equipment. It includes some reimbursements that we give our health centers for the services that they are giving. But these funds that are supposed to be released under the Constitution immediately can be released 7 months later. Every time you have a transition from one financial year to the other one, it takes 3 months for the national government to release funds. So again, I repeat, the function of health is sick because of unconstitutional methods that have been used in the health sector.
And I want to bring the doctor in, and after this I want to open the floor so that you two can get a chance to ask questions. And for everyone who is online and who is following this, make sure that you, when you do tweet or when you do send in your question, the hashtag is Mujadala6 so that we can find it and we can pose the questions to the panelists and indeed to the floor as well. But we opened this year with a threat for the doctors and the nurses to go on strike. In fact, throughout the course of the year, we have seen a number of counties, of doctors and nurses at the county level go on strike. I believe presently there is an ongoing strike. Do the doctors understand that the function of health in this country is already sick? So to go on strike is basically to stab the patient and deal them a death blow.
Good evening, everyone. If you may allow me to respond also at the same time, there's something I'd like to say. I get what the point you're trying to bring across. I agree with the senator that the healthcare function was devolved, but it is shared. Yes. And in Article 1, 189 to 191 of the Constitution, there's supposed to be cooperation. One of the principles of development of the health function was there's supposed to be cooperation between national and county governments. Now, we are talking of doctors, nurses. These are healthcare workers. That is the human resource aspect of the same devolved function of health. Yes. We have the infrastructural aspect of the healthcare, which is the facilities. He's talked of level 5. He's talked of national referral facilities. Yes. Now, I agree that the health sector has been sick in this country for long. But I'll take you back to 2013 when we went on strike. Why did doctors, nurses go on strike? There was a protest. The protest was, do not devolve the function without clear policies to manage healthcare human resources. We didn't talk about facilities. And in the return to work formula, which was signed by the Cabinet Secretary, Ministry of Devolution, our Secretary General, it is clearly laid out that one of the points was we're going to have to set up a system and a policy to manage, to ensure management of healthcare, human resources, and transition. Now, why are doctors going on strike? We are, I'll say this, doctors, nurses are highly skilled, technical professionals. We are not politicians. Now, there is politics and there is reality. That is the truth. The reality is there is absolute mismanagement of healthcare human resources in the counties. This, we've sat with the Transition Authority and come out with a very good document highlighting all the issues. Why do doctors go on strike? We do care for our patients. We do want to take extremely good care of our patients. There are two aspects involved. One is, when I talk of mismanagement of healthcare human resources, I don't understand how, as a doctor, I can walk to work every single day for a whole month, even do night calls. We do night calls and day calls. We continue working for over 168 to 70 hours a month, sorry. And at the end of the month, one, my salary is delayed. It's clearly laid that there should be cooperation between the two levels of governments. That shouldn't be our problem. My problem should be my pay. Second, the same delayed salary comes less allowances. I'm getting 80 or 70% of my salary without adequate explanation. He's talked about an integrated system. The payroll is an electronic system. Of course, the input is from the payroll managers and all. But why would someone pay me 70%? You see. Now, the other thing is, at the same time you've paid me, you've done statutory deductions, you've done other deductions to credit facilities, financial institutions. We even have NHIF, NSSF. I, as a doctor or a family member, become sick. I walk to NHIF and I'm told, you're not updated for the last 8 months. This is happening in the counties and we do have the reports. So I'm now locked out. Myself as a healthcare provider, I'm locked out. I'm not able to provide services. This issue of salaries is actually has an effect at the family level of the nurse or the doctor. So you also have to understand that we are humans, one, that you also have social responsibility. So it goes on to a point where I cannot come to work hungry. At some point I have to. The other day, a doctor in Nyeri had not been paid for 6 months. And she goes to our forum and says, did I do something wrong to choose this career? This is the motivation of healthcare workers, and this is a reality. So when you see health workers go out there, we've been pushed to the wall. We do care for our patients. We want to provide the best. In fact, if they can increase the healthcare financing, because that is an issue we've also been talking about, increase the budgetary allocation. Kenya is a signatory to the Abuja Declaration of 2001, in which 15% of the national budget should be allocated to healthcare. What are we getting in Kenya? For the past decade, just have a look. We're talking of 3.6. I think the highest we got to was 6.5% in 2012-13 fiscal year. Last year, 3%. Last year, we went down to 2.6. This year, we've at least gone back to 4%. So do 2.6% of the required 12, 15%. At what percent are we financing healthcare? And that has a trickle-down effect, not just on the human resources, but also on the facilities, because there's not enough money to ensure that if I go to work, and the senator will attest to this, that if you go to work, you sit in your office, you want to sign a document, and you tell them, print out a document, I'll sign. And you're told, we have no papers, Senator. We can't print your document. You can't sign your document. That is what we face every single day when we walk into the facilities. We see patients, I know exactly what I'm supposed to prescribe and give. But what happens? It's not available. So, and I'm talking out of experience where you actually supervise, and I'm sorry to say this, to use this word, but we actually supervise death. Someone is dying in front of you and you're not able to do anything. So now, to save this person, I'm sorry, it reaches a point where you have to now say, enough is enough. Maybe they will hear us when we go on strike into the street, so that we save the same Kenyans. We're not doing it for ourselves, it's not selfish. It's for Kenyans. We do love our country, we do love our profession, but we have to save Kenyans.
There you go. The missives from where the money is going or not, what should be happening, which isn't, and the effects, which are that people are supervising death. Your turn to ask the panelists any questions that you may have. The doctors themselves are not entirely innocent. It is not once or twice that we have heard of the practice. Anecdotal, I do not have sort of numbers behind it, but I'm quite sure that if we invited a survey, we've got Ipsos in the house, we would find out what the numbers are, of doctors who run concurrently, which is acceptable. I do know this, that under law it is acceptable for a doctor to be both in public and private practice, but who run the public practice almost as their referral to their private practice, who run their public practice almost as the way in which to access the medicine cabinet so that they can put drugs in their private clinic. And this causes a loss in, a perceived loss in confidence of the doctors themselves. Doctors and nurses are not entirely without blame for the practices that are seen at the county level and even at the primary health care level. Oh, I know he's going to burn me for this.
Interesting one, huh? Yeah. Now, I'll start by one thing. There is a misconception in this country. And when I talk about misconception, we have doctors. Now, if you go to the hospital, anyone in a white coat, even the cleaner who puts on something white, is going to be called a doctor. We've had cases in the media where we're being told a doctor allegedly raped. But when you read through the article, and when you try to find out, it's not a doctor by profession. It's probably a clinical officer, an anesthetist. That was the last. So who's the doctor here we're talking about? Back to your question. Now, the private practice you're talking about, as per the Kenya Medical Practitioners Dentist Board, private practice is for the consultants. And when you talk of consultants, we're talking of specialists. These ones are now the topmost skilled doctors, gynecologists, pediatricians, surgeons. They are allowed by law to have private clinics and have private practice. Now, what happens in the public healthcare system? For one, we are very scarce. I'll tell you for a fact that if you look at the CAPS report 2014, Kenya has 325 specialists in the public health sector, serving a population of over 40 million. Now, what is happening in the facilities when you come? You're going to have long queues, like surgical cases that can take up to 7 months. So a patient decides, I cannot wait for 6 months. Is there a private practice where I can see you as a consultant and I get sorted out? Because Kenyans are actually sick, that is the truth. Disease cannot wait for time. And why, and whatever you're talking about of doctors in private and in public healthcare, I can assure you for a fact that it's mainly the consultants. And it's actually provided for in the law for them to have private practice. There's no data because medical officers, clinical officers deal with so many patients. At the end of the day, you do not have the time to go and start doing private practice. That is the truth.
My name is Dr. Chitai Murabula. I'm from Third Way Alliance. I'm also a medical doctor. Today, anytime someone talks about devolution, there's a lot of corruption that comes up. In fact, even before we discussed the role of counties in industrialization, there was a lot of information coming in on corruption. And the truth is that at the moment, Kenyans are regretting the process of devolution, in as much as it's in our constitution, but the truth is that Kenyans are asking a lot of questions. And one of the questions that is being asked is, does devolution in Kenya make any economic sense at all? Because if you look at other countries like Japan, they have a GDP of $34,000 per person. Nigeria, and Japan has just 47 prefectures, or against a population of 127 million people. If you look at a country like Nigeria, $6,000 per person GDP. They have 37 states. Kenya, GDP is 3,200 per person. We have 47 counties. So the question is, does devolution in Kenya as it is now make any economic sense?
My name is Lydia, I'm from USIU, and my question is, what is the Kenya medical practitioners doing about the Mugo Wairimus that are going on masquerading as medical practitioners, and they are tarnishing the name of doctors? Because I have several friends who are doctors, and they think that is it's taking away from medicine. Yeah.
Fantastic, thank you. There was a gentleman in front, that one with the stripe. Go ahead.
Kimanzi. I'm an HRD, and my question goes to the senator. I know that we educate our doctors using public money, because a doctor, you know, to have a practicing license, in the little knowledge that I know, is that you will have to take 6 years, and you'll have to probably get some help loans so that you can be able to, you know, complete your education. And my question is, if you take a whole 6 years to educate a doctor, and then you pay them peanuts, what do you expect? Because they're going to find other ways to pay their bills, and probably they're not going to give priority, say, to the public, maybe health centers. They're going to give priority to their private practice so that they can pay their bills. And I think we need to be asking what the government is doing in regards to, you know, even advising the SRC when they're reviewing the salaries. I mean, can they be able to say, look, the doctors are here, can we have a policy of honest work, honest pay, and increase the salaries of the doctors?
But with the specific question, do you think medical health services, that it should be the responsibility of county government or central government? Population is pretty split. 46% think the central government should have this responsibility, 40% the counties, with about, and 10% both. And we haven't released this, by the way, to the media, so it's the first time. With about a 10% difference between court supporters being more supportive of the counties having this responsibility than Jubilee supporters. But for my question, that there are some structural issues in the authority for funding and so on in the Constitution. So many of the, I think the complaints or the issues that have been raised are legitimate ones and would be there even if not a single shilling was stolen. That's a different issue. And there have, of course, been some accusations that there are certain people in positions with influence who are deliberately trying to undermine the capacity of counties to take this function so that the central government, the ministry, will be able to keep controlling even more funds than they are already. But just for my, and you can respond to that as you like, but just for a question to the respected Auditor General. I saw somewhere, it might I might not have seen it correctly, that the Ethics and Anti-Corruption Commission has now or recently established a presence at all 47 county level. I don't know if that's true, but whether it is or not, from your point of view as Auditor General, what type of capacity does this country have to actually examine expenditure in health or any other sector at the level of the 47 counties? And if that's not your responsibility, then whose is it or who should it be?
And to those, I will add two more questions, gentlemen, coming in from Twitter. From Madam Mugoya, directed to Dr. Mwachonda. What is being done to address corruption amongst our doctors? Haslers, having your question, has the government prioritized healthcare service delivery?
I'm glad that Tom Wolf is here. In all the surveys that they have done, beginning 2013, the figure on the Kenyans supporting devolution has never gone down. Never. Now, the opposite of what you are suggesting is to change the structure of this country upside down. We move back to unitary state, Mama na Baba, everything in Nairobi, and all of us kneeling down to government to give us dispensaries, hospitals. We cannot go there. That's a mistake we did in 1966 by abolishing the Senate. We can't go there. Kenyans can't go there. And I've just said that if after 50 years, the central government was unable to manage the function of health when we were not 40 million shillings, 40 million people, what makes you think they will do it now? The Kenyans out there in Bungoma, Kenyans out there in Shimoni, want to see an element of service right where they are. The problems we have had in the last 2.5 years are expected. In Nigeria, 37 governors were jailed in the first era of devolution. I expect more to be jailed in Kenya, going by what my good friend Oko has done in his reports of 2013. If we are going to buy wheelbarrows of 107,000, then we are in trouble. But I believe personally that we cannot judge devolution on the basis of the governors we elected. We elected bad governors, or we elected a bad people in those governments. But the structure that we have put in place of you electing a member of county assembly who will look at your budget, who will approve why you should have a wheelbarrow or not, and a governor who is supposed to follow that procedure. In future, you're going to make a good decision. So I have no problem with that, about devolution. And countries like India are where they are because of the structure of devolving. And they have devolved to the village. We have just devolved to counties. They have devolved to the village. There are people who are of the view that we should have less counties. But go and ask a Kenyan, particularly where I come from, to have Machakos, Makueni, and Kitui merged into one county. Oh my goodness, you're going to be stoned. It's a fact, because it means that the headquarters will have to be further away from either Kitui, Makueni, or Machakos. That's the problem. So, and again, you must understand that the structure of our devolution is also through the constitution. The independent constitution had 41 districts. We only split 41 districts and added 6 districts. That's why we have 47 counties. So originally, that's how Kenya was. And that is a compromise that we have made. So I'm pleading with you, if I'm going to be your priest today, I'm going to preach to you to change your mind about devolution, because that's the future of your children and the future of this country. I do not think is in central government. That cannot work. The Tom Move, maybe before the Auditor General answers the question, the Senate has proposed, because what is the purpose of devolution? We cannot have devolution where offices are in Nairobi. The office of the Ombudsman should be in every county. That is the person who checks the work of public officers. Anti-corruption should be in the counties. The office of the Auditor General must have an office in the county. The office of the Controller of Budget should have an office in the county. And I want to explain. If you are to use the words of Githu Muigai, the Auditor General is a mortician. His work is to undertake. This comes after the money has been stolen. I am looking forward to a system where we will be checking every quarter so that we flag these issues before these people run away with our money. Thank you.
Senator, before you go away, and still following up on the doctor's question, should we have fewer accountants?
That is a question for the referendum. That's what I've just said. For you to have fewer counties, you'll have to merge Kilifi, Lamu, Mombasa, and Kwale into one. For you to have fewer counties, you'll have to merge Nairobi, Machakos, Kiambu, and Murang'a. Just make it small. You go to Nandi, you merge Nandi, Elgeyo Marakwet, Trans Nzoia, and maybe one more. Busia, Kakamega, and maybe Nyamira. It's not going to work. Not now. Maybe in future. Just the same way we have put something called an equalization fund. I don't know how many of you know what an equalization fund is. It's in our constitution. What is the purpose? There are places in this republic that tarmac is only seen in newspapers. That water is an alien term. Electricity is an alien term. You, the citizens, said that there are marginalized counties that should be accelerated to a level like Kiambu and Murang'a and Nairobi where there's tarmac and water first. So before you get to the argument that you need to merge a county or you need to reduce the county, you want to ask yourself, are the counties in this republic equal in terms of resource, in terms of infrastructure? The answer is no. That is the reason I've said that before you can determine that one county is at almost, maybe equal is not possible, almost equal in services, that's when we can start saying, let's merge Murang'a and Nyeri and a neighboring county to become one. But if you go to Nyeri and Murang'a and any other in Central Province, they will tell you, we have been marginalized also. So that is the point, and it's an argument we can do maybe in another 20 years, just the same way we have put a sunset clause on equalization. We have determined that in 20 years, if we constantly support some counties, we will most likely bring them to the same level as the rest. And then in 20 years, we can then merge Nairobi and Kajiado, you know, or something.
Thank you.
Yeah, thank you, Rene. And I think I must also just amplify something about devolution. You know, I think if you ask yourself that Kenya was a unitary system, and if you are looking at it in the terms of the budget I was talking about, that budget was just one cake. Yeah. It was round, and it was being used for all of us. And we haven't changed. There's nothing which has changed apart, okay, the population have grown, but even the budget, that cake is supposed to have grown. Now, for the last 50 or so years, this cake has been round and it is being given to us from the top. And most of us, we still had a lot of problems which even called for the change for constitution, because Kenyans were not feeling these resources on the ground, and they said there's something wrong about this unitary government. We want to know how this cake is divided, and therefore they also said we want to have not just one single person in the unitary system dividing the cake. We want what you call the Commission for Revenue Allocation, so that it is independently checked that it has been divided well. Now, the little which has been divided now post the new constitution, everybody here, those who have gone to their counties, despite even the wastage we are talking about, can actually see the direct impact. In some cases, I think in Mandera and the rest, they're saying they're seeing a tarmac road for the first time. Yet it is from the same cake. Do you understand? There were no new cake which was brought in when we had the devolution, when we started the new constitution. The Kenyans, I think devolution is here to stay. what we should work out is now the issues which I think Tom was talking about, the issues of accountability. What are we going to do about that? Now, we do not, what I believe we should is that as much as we transfer more resources to the ground, we should also make sure that we increase the resources for control concomitantly. You know, the budget, since I came to this office, came from just under 1 billion to now we are in 1.8 trillion. Yet the resources for the people like the EACC, the Auditor General who should check these things, have not grown equally. So we have to be serious. We have to recognize that devolution has to stay and that more money must go to devolution, and that we must ask for more accountability, and our institutions which are meant to control must be facilitated. Now, yes, institutions should be facilitated, but they must respond to the ordinary person, because the ordinary people are now seeing things on the ground, things which are happening, you know, the wastage. And they are asking, where is the EACC? Where is the Auditor General? And that's our challenge. And that's what pains me and keeps me awake every day, even as I go to my county. Because there I see some people are seeing glaring issues of wastage. So I'm obliged to change my thinking. I should no longer be a mortician, if I was before. I should now change to be a real doctor with medicine to prevent and advice to make sure to prevent the deaths. So offices like mine should be capacitated, but I also should be required to do work which resonates with the ordinary person's urge for accountability. In other words, I should be able to be present at the county, be able to do work which are going to be preventive and deterring, rather than work which is going to be just detecting things which have happened. And we are trying to do that. We are recognizing that resources are not unlimited, but we know that there is good use of leveraging on technology. I can see the questions are now coming really live. We can actually find a way of working with the few resources we have and invest in technology in a manner that I should be able to do audits which are called smart audits. Audits which are timely, audits which are picking up issues as they happen or before they happen. Because I believe with information technology, with social media and all that, we should be able to now start thinking how best we can respond to the checks and balances and the control of this money. In other words, we should be able to follow that money from the time I say it is budgeted for from 1st of July to the time it hits the county and to the time it hits the health project on the ground. That money, we should be able to follow it and see it actually hits the ground, and hence we should know what is budgeted, what has been spent at the point in time, and what really has hit the ground. Yes. In other words, where Wanjiku is, where it's supposed to transform the life, to give some transformational, the health, the chapter 4 requirements, Bill of Rights. Bill of Rights. So that I need to respond to that. And to do that, I will need to call on and work smartly, not only on leveraging on technology, but also connecting with the other people who are active on the ground in the audit process. Thank you.
We do understand the positives that have come with devolution. Yes. And if you do look at the Kenya Health Policy Sector 2014-2030 policy document, look at the Kenya Health Strategic Plan document, up to 2015-2030. The truth is, on paper, there is a very good plan of how the healthcare function should go on and should proceed. But what is the reality? And I'll go back to the reality. The implementation is a problem. Now, why are we having a lot of noise from the healthcare workers who are supposed to be treating patients on issue of devolution of healthcare? Historically, we had a Bombers draft that had a Health Services Commission. In Naivasha, it was expunged and there was a provision that is going to be introduced in Parliament, as an act of Parliament, to manage healthcare human resources. There was a reason for that. Because we are a country that healthcare workers are a scarce resource in this country. WHO statistics talk of 234 per 100,000 healthcare workers. By healthcare workers, I mean from doctors all the way to nurses. Kenya, we are at 163. And now we have devolution that has come in. What has been happening in the counties? The truth is, tribalism has come up. Doctors are being rejected. That is one aspect. And we're having marginalization of certain counties where doctors are not able to work in certain counties. So what do we need going forward for healthcare function and the devolved system? One, we want a central body to manage healthcare human resources, and this can be done. It can be done in an act of Parliament. We have the health bill coming up for discussion in Parliament, Senator. Yeah, you get, okay, yeah.
Second reading.
Okay, second reading, yeah. So that was an opportunity for us to have, let it be debated in Parliament, let us have it. And when we look at the central body, look at TSC. TSC has a policy where teachers are able to work in certain counties for 5 years. Right now, the truth is, if I work in a county, County X, I'm stuck there, getting, after 3 or 2 years, if I do want to move out of that county to a different county, I'm literally stuck. And what does public service guidelines talk about? That I should be able to work anywhere in this republic. So that is one aspect that really needs, especially human healthcare, needs to be checked. Now, I'll go to the infrastructural issues. I'll talk of the level 5 facilities. You highlighted clearly how they cover regions. It's more than one county. Like we're talking of around 6-7 counties. Yes. The budget that is given to Machakos, to Kosiendo Nyeri, is the same that all the other counties are getting. So what is happening? There is straining financially of that institution. And what happens? Smooth running of that institution becomes impaired. And that's where we have health services delivery being affected. I think I've touched on that, what we really want. Now I'll go to the question, what is KMPDU doing about the tarnishing of doctors, the Mugo Wairimu case? Now, I'll say this, we are a union, one, that we have a Kenya medical board, that is a pharmacist and dentist board, that by law is empowered to deal with such cases of malpractice and all that. Now, this same body is operating under law of 1978. Its powers are clipped. Financially speaking, they are clipped. We have only one office in Nairobi that is supposed to go around the entire country to supervise. Now, what happened with the Mugo Wairimu case is, as a union, we've worked closely with the board to ensure that such cases do not happen. But at the same time, we need, honestly speaking, for such cases not to go on, we need a change of the law to empower the board to be able to deal with such cases. What is the fine for if Mugo Wairimu is found guilty? Do you know the fine?
Don't tell us.
10,000 shillings, Senator. Yes, 10,000 shillings. Isn't he going to get 10,000 shillings to be scot-free? What has he done? Police are now saying they have no adequate evidence to show that he actually did what he did.
No, let me just correct you on that one. He's actually been charged with 12 counts, including rape.
Okay.
Yes, in charge.
Okay. Thank you.
But it could have gone that way.
Yeah.
And for a while it did look like it would.
Yeah.
Proceed.
Yeah.
Practicing without a license, is that what you were talking about?
Yes. If you're caught practicing without a license,
Yes.
fine is 10,000.
Yes. And going forward, what we want to do as a union, we want to do like a public. We want to have the media involved and all other stakeholders, just to tell you, to give the public an idea of who the actual doctor is, because that guy who cleans in the hospital learns slowly how to give injections, and you call him a doctor. That's what's happening with Kenyans in rural areas all around the country. So that's what we're going to do as a union. There's the question, can doctors be paid well by SRC? Now, this is a hot topic. I wouldn't lie. What is happening with teachers currently? I think you're all aware what is happening with teachers. What have we tried to do to make sure that doctors are paid well? One, we do have a CBA that was negotiated signed in 2013 June. What was the role of the SRC in the same CBA? They were supposed to advise and give their input so that the CBA is implemented. The Ministry of Health was supposed to ensure that the same CBA is registered and implemented. Do you know what happened? This is Kenya, my friend. SRC kept on giving us obstacles. Ministry of Health, same thing. Where are we now? We are in court. The CBA is actually in court. I wouldn't want to discuss more on the CBA because it's in court.
Thank you.
And there's one more question, Haven Hassan.
Okay,
Has the government prioritized healthcare? I'll say no, with a lot of confidence, and there's data to show you. The Auditor General's report has given us county breakdown on the health sector. Let me just use one county where ambulances were procured, Machakos. 145 million, I believe. And what these same ambulances were, one, second-hand ambulances. They were not new ambulances as the way they were designated to. How are the ambulances registered? And a private company. He'll agree with me. A private company. This is supposed to be a county government property. It's government property. It should be registered under the government. It's registered under a private company. And was the evaluation done in the Public Procurement Oversight Authority? There is the process of procurement. It was overlooked, literally. They did not do a feasibility study. They did not, how did they come to a number of 70? It's not clear.
Ward 67 locations.
But these same counties, these same ambulances, are in his recommendation in the report, are not, it's not clear where they are.
No.
Yeah.
That's true.
It's not clear where they are. So what have we done? We've not prioritized healthcare. What is the healthcare financing per year by the government? The government has a role in public health sector, and that's the role of the government. I talked about the Abuja Declaration. 15% of the national budget should be allocated to healthcare. What has the government been doing over the years? 2, 3.5, 4.5, 6%. Honestly, the government has not prioritized healthcare, and there needs to be a change in all this.
Hafsa from USIU. Okay, mostly to the Auditor General. When Renee told us the statistics, it didn't really make, it wasn't as important as it should be. My question is, does it bring that lack of integrity and the lack of competence to the lack of accountability to the sector? The statistics she gave, the 36 billion, then it was 32 again, then it went to 41 billion. You see, there is already a subtraction, then addition, then a subtraction of some amount of money. Does that mean there's that lack of there's that competence?
Excellent, thank you.
Good evening, everyone. Yes, my name is Dr. Ouma Oluga. I am the Secretary General for KMPTU. And Dr. Mochonda is already doing a good job. Just shortly, I think as a union, we have been the voice of healthcare, trying to speak about the things that mean much to Wananchi. In Tom's report, he talks about 46% of people that he polled saying that health should be managed at the central level. Those people actually know what healthcare means to them at the facility, because as much as we were talking about the indicators, and Senator, I can tell you that 2 years down the line, now we are losing 420,000 Kenyans. 2 years ago, we were losing 200,000 Kenyans. There are more, if you look at the indicators for TB and default for HIV drugs, if you look at the indicators for non-communicable diseases, if you look at the indicators for cholera, we are doing much worse as a country. If you look at the number of deaths per admission in hospitals, right now we are doing almost 35% That means 3 out of every 10 people admitted in a public hospital are dying. If you look at the waiting time in Kenyatta National Hospital, if you look at the number of patients that go to a county hospital and are being referred, they are now 70%. And thank God counties have bought ambulances to do that so that they can abdicate their duty. They are running away from their duty of giving health care and taking patients to Kenyatta and MTRH. And the other thing that I wanted to talk about is we as the healthcare workers and as a union, we've never been against devolution. What we have talked about is structures being put in place to help devolution. And I want to make it very clear to Kenyans and to everyone in this room that we have been actually in the forefront talking about those structures as well. Dr. Mwachando already mentioned the Health Services Commission, and we are not talking about a commission just to manage doctors or healthcare workers at the counties. We have problems at Kenyatta National Hospitals with training of registrars, people who are working for 168 hours a week without a single cent. And we are talking about Mugo Wairimus, people who the law does not allow, like even the board, to charge them beyond 10,000. So we are talking about looking at healthcare workers everywhere, where they are trained, where they are working, their qualifications, the services they're giving to Kenyans. And lastly, the issue of counties and ethnicity. We are looking at healthcare workers and specifically doctors as a scarce resource. So if you're looking at devolution, helping distribution of resources, then the human resources for health is actually not being helped, because in 2 years, 2,000 doctors have resigned. Marsabit had a surgeon, now they do not have any. There is no specialist in Mandera. Mwingi District Hospitals just lost 2 specialists in the last 2 weeks. And I could go on and on and on and on. So 2,000 doctors leaving public service, 700 being rejected by counties. How is devolution helping this scarce resource called human resource? Thank you.
My name is Julius Okoth. I'm a social justice activist. I've got only one question, and it goes to Senator Mutula Jr. We are Lupens, you are citizens. We always vote and give you powers to go and do what pertains to what we have sent you to do. You have talked about that it's about only 93% of what have been done about devolution. The only thing that remains about procurement and supplies of medicines and equipment. 7%. So we as Lupens, after giving you powers to go and do what you're supposed to do, what have you done so that this medicine and supplies can come to the counties? Because if you don't do that, very soon you're on the street after you people. Thank you.
I'm Samuel Orlando from Economic and Social Rights Center. Simple question to the Senator. From your first presentation, am I right to hypothetically say that the central government is stifling the evolution of healthcare with regards to the statistics that you provided? Secondly, the person who was questioning the economic sense of devolution, to kindly visit Lodwa or Garissa. That way you will appreciate devolution more. Thank you.
My name is Dr. Oga Wesley. I also serve in the union as a NEC. And my question specifically, I'm sorry to you, Senator, seems everyone is on your neck today. Now, Article 175 of the Constitution, which was the principles of devolution. 174. The main thing it emphasizes is the equitable distribution of Kenya's resources. As a human resource, at the moment, we have, I can't even call it unequal, but there are counties that generally do not have specialists in anything. What, as you, as the protectors of the devolution, what are you doing to ensure at least the human resource aspect can be equitably shared as a country?
Thank you. My name is Oro Michael. I work at SID and USIU as well. Quick one. I agree with the senator that devolution of health is justified. I agree with the KMPDU that there are issues around staffing, welfare of doctors, and all this stuff. But I keep wondering, when we bring the conversation to the question of where should we locate health and healthcare, whether it is at the national level or at the sub-national level, aren't we running away from the fundamental question that does it matter if what the senator said since 1963, that will bringing healthcare to the national level fix the historical problem, systematic systemic challenges that healthcare has had? Or this is just an excuse? So for KMPDU, I completely understand. We can't fix security without dealing with the daily lived realities of the quality of life and terms of service of police officers. The same would apply for health. But is this the bigger question? Where to locate it, or to deal actually substantively with the issues that bedevil the sector?
What's your take on the two counties that use their health sector money for buying? There's one in Meru that used their money for buying curtains that costed around 7.8 million. And there's another one in Kisik, Nyamira County, that used approximately 8 million for building, I don't know, it was a referral gate or something. My second question goes to the doctor. We realize that there are some funds that have been set aside by the Ministry of Health for maternal health care for these pregnant women. But we realize that lately, most of them from the marginalized counties, they're embracing more of, like, they embrace more using of the midwife at home rather than going on to the hospitals. What's your take on that? Thank you.
Gentlemen, you have the questions. A couple of ones, once again, from on social media. Quick fire, I'm not going to ask all of the questions, but one going out to the Auditor General. Can or is the Auditor General using already existing structures such as Huduma Kenya, the way NTSA and eCitizen already does to reach Kenyans? A comment to Dr. Mochonda: all efforts aimed at centralizing human resource for health must be in line with the Constitution. And the comment that it's interesting that you want to bring back the centralization of human resources to central government. Another one for the doctor from Gatehio: conflict of interest, absenteeism, nepotism, attitude to work, bureaucracy are the structural challenges affecting the human resource in the health sector today. What is your take on that? Still on devolution, I'm afraid, Senator. Devolution doesn't make sense in Kenya because it has created 47 governments that have only devolved funds but not functions.
We must understand that, and I want to respond to the question of the 7% capacity to procure medicine and supplies for hospitals. It was felt, and if you look at the Constitution envisaged a situation where some functions you will have to build first capacity. And we must agree, the procurement of medicine is a very complicated exercise. There are some medicines that are supposed to be kept in freezers. There are some medicines that are not supposed to be out. There are some vaccines that cannot be exposed. And therefore, this is extremely specialized. And you actually do not want some of these vaccines in rogue hands or in people who are not properly trained. This country invested heavily in KEMSA in terms of procurement of supplies and medicine. And they have also capacity, because procurement of medicine is not a local issue, it's an international issue. And that capacity is there. So for the time being, that capacity is nowhere near any county. And that is the reason why it was felt that since this particular government, this both at national and county level, in my own take, they are all transitional governments for purposes of the first implementation. And therefore, unless we are satisfied as a country that we have developed capacity in Mandera to fly vaccine malaria to Mandera, that we will still leave it at a level where it can be done. Although we must admit that the corruption in the procurement of these supplies has also invaded KEMSA and has created all sorts of problems, so that the medicine that is supposed to be in your public hospital is in a private pharmacy, yet they are procuring it at a rebate, which again is the cost of production. So in terms of oversight, the country must ensure that there's oversight. Because one of the things I must say about this republic is that it is expensive to be sick. Do you realize it's very cheap to be, keep healthy? It's cheaper for you. The minute you get sick, you will have to dig deep. Cost of everything has gone up just because we have transposed the cost of corruption in the procurement of medicine, the supplies and equipment to mwananchi. That is the simple way of looking at it. And now there's a new word which you must now write. It's called tenderpreneurship. So there's people who have specialized in tenderpreneurship in this republic. I was reading an article in the newspaper recently, not in an article, that how many of you know that Kenyatta National Hospital, for example, used to produce its own IV, the IV. They used to produce it, isn't it? But now they don't, because somebody must make money. So those are the challenges we are having in the system. And we must say that unless we deal with that system, I don't think it's easy to clear the problems that we have had. The unequitable distribution of resources. I don't know whether you are aware. When the national government decided to procure machines for county governments without telling them, the county governments were faced with a challenge. Here you are with a radiology machine and you don't have an expert. So they were forced to hire. And and let me tell you, you might not know that this country has got a highly educated population in all aspects. And therefore, in the procuring of some of these machines, renal, ICU, radiology, they had to procure specialists. So we have allowed counties to look for engineers, because one of the purposes of devolution is to also have the function of employment. We must employ people. This rural-urban migration of employment, we must stop. People must be employed at source, because we have those people and they can be trained. And where there is no capacity, national government can offer. And where you do not have, you can train. Because I do not believe that it would be an anathema or a contradiction for a county to send Ouma to go to Russia to study so that they can come and become a specialist in a hospital in whatever location it is in the county. So the fact that we do not have specialists, for me, is just telling that we need to create more employment by creating the services that need this sort of things. These people who bought curtains worth 7.8 and a gate worth 8 million shillings, the situation gets much worse, by the way. But let me tell you where the problem is. The primary oversight, as primary as it can get, it means what you can see with your own eye, what you can perceive, is on your members of county assembly. Not a coin is required, can be spent in a county without the approval of the assembly. So therefore, without even checking what the details are, it is assumed that the members of the county assembly of Nyamira approved the gate. It is assumed that the members of the county assembly of Meru approved the procurement of curtains. Because this is not the sort of project that you can do without procurement, without an approval, without a budget line, and without a plan. All your counties have got something we call county fiscal plans. County fiscal plans are done at the beginning of the year, which then translate into the budget estimate. So I'm assuming that your members of your county assembly of that region debated this issue, banged tables, voted, and approved. That is the question I have in my mind as to what they think. The county of Elgeyo Marakwet approved a budget of Congo Brazzaville of 5 million shillings. When they came back to the Republic, they said, oh, by the way, you forgot, we yet have another trip. Now, that is oversight. The people who are supposed to be doing oversight are playing around with the money. But we have said that the solution is what the Auditor General said, that internal audits are missing. Instead of and we have called him several times. He has been to the Senate as many times as possible because we are doing special audits on at least half of the counties. Every time money is stolen, we look for him. Please go and do a special audit, special audit, special audit. If his office had an officer stationed in Nyamira, we would get a special audit in a week, in 1 week. Your constitution says that if money is spent by a person in office which is not authorized or which is illegal, it can be recovered from him personally, whether in office or not. So all we need to do is put mechanism in place and put people in jail. Simple. So as far as I'm concerned, we ought to create a budget of, increasing our jail space because we need to jail a few people. Na liwe funzo kwa watu ambao wana tabia kama hiyo. Thank you.
Thank you very much. I think there's one few questions for me, but the young lady from USIU was asking about the reconciliation of figures, 3 different things, and I think you are wondering why should there be 3 different figures in books, which is wrong, because ordinary logic says, surely, I mean, it's what you spend, when you spend something, you should record it. And at the end of the day, what you recorded should agree with what your books say. So if there is any difference, then there should be an explanation. That's all we ask. In case there's a difference, there should be an explanation. And that explanation must be satisfactory. It must not be, and it's also cannot be that big. If it is too big, then there is something wrong. So that's why we talked of my opinion being qualified, or saying that the accounts where there's so many differences like that, I simply say they do not reflect the true situation of the accounts. And the accountability requires that people are employed who are supposed to be keeping those books from 5 to 8, or from 8 to 5, and they should, and most cases they're professionals, so there should be no excuse. So one of the things of the problem is what you call professional rigor of people who are charged with this kind of job. Now, the issue of devolution of health, okay, what I see on the ground and what I see in the arguments, and I think we are in agreement about the importance of service delivery on the ground. That one you cannot tell. Now it is a question of the structure of delivering that service. And that's not to say that devolution is not working. So I think we should not mix the devolution with the structural problems which we should solve. That's the only thing and which are solvable. And which I think you should give time. Remember, this thing, there is time which should be given for certain of these things to work, to find out why are these problems are still there, or what should be done to correct them. The other one is about the Huduma centers. I think Huduma centers are I think somebody tweeted, Huduma centers are a good idea. We should increase them. And for the Auditor General, I would one day hope that all my reports also would go to the Huduma centers for people to access them readily. Let me stop there. Thank you.
There's something I didn't answer about the fact that the funds, your question about stifling of the function. The system is sabotaging itself. Because the health function has got a lot of resource. And the resource is not only local. The money we are receiving from donors is immense. It's a lot of money. And the cartels that have benefited from the cash cow called health will do everything to make sure that that cow is fattened every day. And this financial year we have fattened that cow by an extra 10 billion shillings. The contradiction is as follows. If you have devolved the function of health up to 93%, why should one cow remain fat and the other one continue being thin? That is the question is simple, that it's a systematic problem. The central government, as government, might not even be aware that there's a sabotage in the system that has been benefiting from procurement. I called it tenderpreneurship. false tenders, increase in tenders, buying hospital beds every 5 years, buying mattresses, everything, including mortuary fees. There are people who are billionaires in this republic from just doing these small little things as buying needles, syringes, and even gloves. They will not let go of that unless we shake the system until all the fruits fall. Thank you.
Before I answer my questions, one or two things that I need to put out clearly. I think when you came here, the theme is corruption and how it's affecting healthcare services delivery in the country. Can you hear me? Yeah. So when you look at corruption, we are talking of what is corruption? It is those who are in power abusing their power. We have corruption in 3 levels. We have what you call bureaucratic corruption, we have institutional corruption, and we have low-level corruption. And in the health sector, this is a reality. With devolution, procurement is across all counties. Now, there is the guidelines for prevention of corruption that were given in 2009, Public Procurement Oversight Authority, and Ethics and Anti-Corruption, then still KSCC then. And in that document, in the report, they lay out clearly how, in Kenya, procurement in the public sector accounts for over 10% of the GDP. And that in the same document, they clearly outline how it's one of the largest markets in the country for contractors, suppliers, and it's the highest opportunity for corruption in the country. So when you come to the health sector, that issue of procurement is the biggest, and the Senator has agreed here, is the biggest problem we have in this country. When Portas came, he said one thing, that the biggest impediment to development in Kenya is corruption. And it's sad that our legislatures, MCAs, are doing what they're doing. But then as a public, you have the powers to actually call them and ask them and to actually account for what they've done. It's in the Constitution. Kenyans sometimes, I think we sleep too much and focus on whether we have food or not. Eh? Yeah. So now, question, where should we locate healthcare? We're bringing healthcare to national level help. Now, I want to lay something straight and clear about what the union is advocating for. I think, and I'll answer this together with the question where they say, one asked where centralizing healthcare human resources be aligned in the Constitution. Now, if you look at the Constitution, or we talked of Article 174, where we have the principles of, and we have the 4th schedule of the Constitution, that clearly, he said it's a concurrent function, that it's shared, national and county. So, what we are not saying we want the entire sector be taken back to the national government, because the truth is they mismanaged it all along. What we want is sort the healthcare human resources centrally. And we're not talking of centrally meaning just one inclusive like the ministry. We're talking of central body where even the counties themselves will be represented in the same body. What will it do? It will ensure that healthcare workers in the counties are able to transfer from one county to the next. That when it comes to career progression, I want to go for studies 2 years from now, a county cannot hold me back and tell me it's not a priority for us. And it's happening in the county. It's not a priority for us. I want to go and do pediatrics. I mean, we have enough pediatricians, I know. And one thing you have to realize is that healthcare workers are the highest migrating officers in anywhere, even in the country. So what is happening currently? We have healthcare brain drain, and it's real. Even in the East African Scientific Conference, and even in a conference just recently in Westlands, we were talking about the same issue, that it's actually a real problem. So part of helping the system is, can we realign the system to fit with the Constitution? That we have a centralized healthcare human resources for the entire counties. It will deal with the question that was asked here, how do we share and ensure equitable distribution of healthcare workforce in the country? That will deal with that, because we can do policies that I have to work in a county for 3 years, that a consultant has to work in a county for 3 years before they think of going elsewhere. Nepotism, mismanagement of healthcare human resources. How is it happening? And the truth is, these things are real. I personally walked to, I won't mention the county, and I'm told, this was in a county public service board I'm talking to, and they tell me, you come from this region, and if we got a doctor, 2 doctors, you come from this region and a doctor from another region, who will we choose? They told me, we'll choose you. We'll leave at the other doctor. Now these are real things. So imagine this being cutting across all 47 counties. Where are we heading when it comes to the healthcare sector? We need a change. That's why I'll insist again, I'm sorry to, that we need a body that will actually be able to give these directions. Because the truth is, counties are claiming autonomy. They're saying they have powers to do what they want in the constitution. And going forward for the sector, honestly, someone needs to be held accountable. Someone needs to be held accountable when it comes to spending and misappropriation of funds in the healthcare, in the healthcare sector. And not just in the healthcare sector, countrywide. That's what we need.
Ladies and gentlemen, we have literally gone over time, but I've had an extension of about 15 minutes, which gives, until 15:15, which gives us about 10 minutes to allow for the last burning, like you will die if you do not have, and there are doctors in the house. No, that does not give you license to start dying. Hang on. So this is how we're going to do it. If you have asked a question, I will ask you to allow someone who hasn't to ask the question. Randomly, gentlemen, right at the back, lady right at the front with both hands up, and she clearly looks like she will absolutely die. And had you asked the question before? You hadn't. Okay, so lady, and then gentleman with the shirt, so that I practice equality of the genders. With the shirt. And yeah, with the white shirt, right at the end. He knows himself, I have pointed to him. So the 4 of you stand up because Morris is about to lose weight.
Hi, my name is Mike Mutungi. I am the chair of Health NGO Network. The question goes to the Auditor General. What can we do as health NGOs? I mean, we are about 92 health NGOs that are under the network. What can we do to support you in this process to ensure that there's greater accountability and transparency in the management of public funds?
My name is Lynn, and I work with the United Nations Human Settlement Program, commonly known as UN Habitat, and I'm also a student at USIU. So my question goes to the Senator. You mentioned that it's expensive to be sick, and I totally agree with that. But why don't we try and avoid being sick? As in, we are talking about the health sector and corruption, and excuse me for stretching the topic a little bit, but what are the measures that you're taking in Makueni to help prevent or provide basic services that can help curb these health implications? Because you'll find most of the, or rather, I won't say most, some of the patients who are not being attended to are suffering from diseases that are caused by basically lack of sanitation, lack of clean water. So I believe also if we try and work on preventing these causes of the diseases, it can also reduce the impact of corruption in the health sector.
Anne, and I'm from the University of Nairobi. My first question is to Mr. Olko. You said that you do not know how much money was released by the government to the health sector. So how are you able to audit those accounts if you don't know? All right, then are you involved in the budget making process and also the allocation? And also in the recent times, we saw the missing billions, the NYS scandal. Have you audited the accounts? And indeed, was the money stolen or not? Then to Daktari, you talked about the 15% proposed by the Abuja Declaration. I want to know, is it for the equipment and wages? And if it's for the wages, how much of it is recurrent budget? That is the wage bill. And also the Beyond Zero mobile clinics. We've seen them going round in counties. They're fully stocked, but no personnel. who is supposed to manage them? Then for Senator Mutula, was it wise for the government to hire out the medical equipment vis-a-vis buying them?
I'm Kelvin J here, a lawyer by profession and a member of the DRL. My first question goes to the doctor department and to Senator Mutula. One, it's about the cesarean, how ladies undergo cesarean procedure. As in one, if I take my wife today in the hospital, without even proper investigation or without proper looking at the patient, she is directed to undergo a cesarean procedure. And this I'll take Senator Mutula to a question which I wrote to Senate. That was on 7th of July, whereby a lady went to St. Francis Kasarani, and she was directed to undergo a cesarean without even a proper procedure, without even being checked. And later she died. So what are you taking is to make sure that we have proper rules which advocate for proper delivery of patients. Second is on IFMIS. We have seen governors refusing to adopt the IFMIS. This is because that they know, one, when they undergo IFMIS, everything which or tenders will be paid through IFMIS or through accounts of individuals or account of firms. What are you doing to make sure that governors accept IFMIS? Second, you know that the Ministry of Devolution holds account of IFMIS. If I have a registered firm right away, I don't have my password for IFMIS account. And so the Ministry of Devolution can do anything with my account. They can tender themselves a tender and indicate that my firm got the tender. Thank you.
So what we're going to do, ladies and gentlemen, is I will ask them to both answer the questions. Sorry, if I could have your attention, please. So I know that there's still some burning questions, but you will really have to forgive me on this one, because we just don't have the room for longer. So in the 5 minutes that we have, my kind request to you is that you both answer the question and make your closing remarks at the time, and I will wrap at the very end.
Mine's going to be very quick. Sorry, just correction. It's not that I don't know the figure. I just said they're in the budget. I just can't recite them exactly. You can know, right? Now, the other thing, am I involved in the budget? The function of the Auditor General is supposed to be an independent check on those people who are doing the executive, even the legislature, the judiciary, and everybody. So it cannot be involved in the budgetary process. But the audits of the auditor should inform the next year's budget, because things like we're saying budgets which are not been executed and the issues of management should be factored in when we're looking at the next year's budget for, say, in the health or in any other ministry, stemming from the auditor's reports issues. Now, the issue of the NYS, if I audited the account about the 719. 719 is something which came up, and it's supposed to be a special audit which we are on, and which, in fact, many people are on, not only me. But in terms of audit, it happens in the year 14-15, for which the accounts are just coming in for us to start auditing. But even without that, we're still auditing NYS issue as a special audit. Now, the issue of maybe IFMIS, I think you asked the issue of IFMIS to the senator about what he's doing about the governance. I really don't think it is the senator's job to ensure that all the governors do IFMIS is, we have what we call financial management, which is governing everybody, both the national government and county government, and they are required to use IFMIS. So everybody is required to use IFMIS. The issue of the controls in IFMIS, there are controls, but unfortunately things are becoming evident that there could be a problem in controls of IFMIS, as been evidenced by the NYS issue. And this we'll know in detail when we undertake the audit of IFMIS. It will be done. Now let me do a closing remark from what I'm hearing. And I think that, first of all, devolution is the way to go. We want to make sure that the budget and our resources make a change in our lives and in the lives down on the ground. And this will be manifested in health, education, clean environment, generally, and what you'd expect from the government. Now, it is incumbent upon the Auditor General to ensure that these resources actually reach on the ground and have some transformational effect on on Kenyans, because they expect those. So I, as the Auditor General, should be able to follow the money as budgeted, recorded, and as spent on the ground in a manner that I should be able to respond to the ordinary person on the ground. And in order to do that, there's one question which was saying, how can I work with the NGOs? I will try and streamline the process of working with NGO and also leveraging on social media. I will, at a point in time, to know whether these monies are making a difference on the ground, do work which will be in partnership with the NGOs, so that I hope that regularly I would be giving out reports, and very simple reports, which if you take something like the budget for the health in the county, which was meant to give you 10 health centers, I should be able to give a report before the year end that, look here, the budget which you agreed was 10 million, what I see spent in the books is 9 million, but on the ground is only 10, is only 5 health centers instead of 10 health centers. And that information would have come from my partnering with the people on the community, people who are on the ground. And those are the reports which I believe will be what you call smart audits, which will be transformational, because it will bring that issue to before the year end, and it will be should be informed using even the social media, the radio, to the very same Kenyan who expects the health centers to have been 10. Thank you.
Lynn, I want to answer you. I might not have the exact details of what Makueni is doing in terms of preventive health. What I want to tell you is that in the county of Makueni, the health function has been given second priority after water. And other than people dying of old age, we have not had outbreaks. Yet in the last 1 year, Makueni has also had a calamity of floods. But if you want, I can interest you with CIPD, which is about 200 pages. If you give me your email, I'll give you the details. And let me tell you about the details of the leasing. We are leasing equipment for 7 years. Each year we are paying 4.5 billion. Do the math, it comes to about 38. In the Finance and Budget Committee of the Senate, we have done our calculations, and it appears that if we had purchased this equipment outright, it would have cost us 10 billion shillings. Now, just using simple logic and thinking like Kamau and Wanjiku, when you lease equipment for a period, because I still, when I asked the minister in charge, the minister was not quite sure. He was not sure whether they are purchasing or leasing. Because when you purchase equipment, it doesn't belong to you. The equipment belongs to the person you have leased it from. So why would it cost this much? Why would you have a 17% figure loaded on the leasing? Why do I say so? Because I lease my printers. I don't buy printers, printer scanner. But I am charged by the person who leases it to me for the replacements, if any. I don't pay it in advance. In our case, we have paid in advance. So that portion I didn't understand. Now going to county by county. Lamu County doesn't have the same problems as Mombasa County. So therefore, in the spirit of allowing counties to make decisions, the counties should have been requested to confirm which equipment they need. because they are the ones who know. But the government bought the medical equipment, all of it, and sent it packing to county. If you don't know, I will tell you that the governors took 3 months to sign the last page of the memorandum that the national government had entered with whoever it is who is leasing the equipment from, because they were denied the other pages. So we have not actually seen the effect of leasing this equipment. The effect will come in the 7 years, because my mind was to tell me, what are you going to do after 7 years? After we've spent 38 billion, are we going to pack this equipment that has come from Germany in boxes and put it in containers and ship it away? Sounds like a tragedy to spend so much money for leasing. So every time I think about it, I have not seen the wisdom in it. The equipment is good, the principle, but the process appears to me to be wrong. Lastly, ladies and gentlemen, I've not seen any old people except the Auditor General here. You are the sovereign of this republic. This country does not belong to politicians. Now speaking like a politician, belongs to you. These questions ought to be asked. You're leaving too much to the politicians. We have developed an interest in everything. Every pen that is bought, a politician has an interest. The air that you breathe, we're going to develop an interest in it if you don't take charge of your country. So therefore, I plead with you, do not abdicate responsibility, because the Constitution says you're the sovereign. You are the boss. We are the servants. Next time you call me, don't call me the boss. I should call you the boss. Thank you.
I'd like to answer the question. The first one I'll start with is the one you asked about 15% of the financing of 50% of the budget being allocated to healthcare. This should cater for everything in the health sector. When it comes to how much as healthcare workers we contribute to the wage bill, that one I'll have to research. I do not have, probably I don't know if there's anyone in this room who has a specific figure that shows. But I'll direct you to one thing. If you've been keen, something happened, I think it's last week, what Babu Namomba did. And in part of it, he presented a petition to Parliament. It's created a lot of debate. A motion in Parliament. And in it, he's clearly outlining who's really the biggest spender. I wouldn't mention that. But if you're keen, just go have a look at it. Who's really the biggest spender and who's really the lowest spender in the wage bill. The wage bill debate is a different issue altogether. We can discuss that the whole night. Now, there is the question of the cesarean section that was directed to the senator. Senator asked me to, asked me to answer that question. That is one case you've talked about. You said it's Kasarani what? What's the name? St. Francis Kasarani. Okay. Now, what just happened, whatever you described is what we call a maternal mortality. And in our profession, an audit has to be done by the facility one. And what is the obligation of the family that lost this mother? Now, by law in Kenya, there is the medical board. So, what is the responsibility of the family? They should lodge a case, a complaint to the board, and the case will be investigated. And whoever, if there is any negligence that is going to be found, then the appropriate action will be taken against the doctor. So one case cannot, you cannot say that that is happening in the county, in everywhere in the country. The guy seated next to you is a doctor, and he's someone you should talk to on that case. Sawa? Yeah. There's the issue of mothers going to more of traditional birth attendants as opposed to the hospital, and yet we have free maternity. That was the question, right? Now, when it comes to traditional birth attendants, that has been the norm for quite some time. Now, the free maternity services are not perfect. I'll tell you for a fact they're not perfect. And the challenges that have come with it is sometimes mothers come and they almost have to buy everything again. And so now
those who are living in the remote areas, the report goes out to the public. It's free maternity, but if you go to the hospital, you'll actually buy the gloves to be examined, you'll buy the cotton, you'll even buy the drugs, what we call oxytocin, to actually augment your labor. So they tell you they're not able to do what, so they stick back to the tradition. What should we do going forward? That is what we call now, it's part of public health. And what needs to be done is education of the public. And the other thing that has been done, there is the OBA initiative launched by World Bank, that mothers get a card and they're able to access free maternity services based on that. It's been launched in certain counties. We have Kilifi, we have Kiambu County, and others can't quite remember. So that is part of the initiative that need now to be looked into. And moving forward, that should be implemented. Now, I think I'll go to my closing remarks. Beyond Zero. Beyond Zero has faced a challenge. And I'll say this because I talked of a healthcare workforce ratio to the population that is scarce. That even in the facilities themselves, we are talking of, and I'll use maternity for a very good example, because we are talking of Beyond Zero and delivering of mothers, that a whole labor ward can be manned by only 2 nurses. So Beyond Zero requires an entire team to actually conduct the deliveries at that remote location. Now the challenge has been the healthcare workforce. And I wouldn't lie to you, one of the biggest challenges is the resistance to actually employ more healthcare workers to actually see these projects like Beyond Zero fully implemented. To my closing remarks, there's a question that was asked here that brought and one senator said that being sick is actually expensive. And why is it so? It's because in Kenya and in many other countries across the world, we're yet to achieve what we call universal healthcare coverage, where everyone has a right to actually get the highest attainable standard and quality healthcare. Now, what do we need to get a universal healthcare coverage? The 4 pillars, according to the World Health Organization. And we're actually lucky that just this debate is actually coming after the UN General Assembly, where they've actually brought about the Sustainable Development Goals instead of the Millennium Development Goals. And healthcare has actually been brought up. We've had our own delegation going there. I hope when they come, it's going to be implemented. We need to move towards implementation, because we can participate in so many debates and policies, but if you're not implementing anything, I'm sorry to say, 10 years from now, we'll have debaters here again discussing the same issues. So what do we need? We need a strong, efficient, well-run health system. We need a system for financing health services. We have what the World Bank has a report what mentions the good practices in healthcare financing. I won't go into the details of that. Access to essential medicine and technologies. Essential medicines, I can tell you for a fact, is a challenge in 2015 in Kenya, in the hospitals. A sufficient capacity of well-trained, motivated health workers. Where are we on that issue as a country in Kenya? They are demotivated. Healthcare brain drain is real. So something has to be done.
I emphasized this when we went into the elections last time, but maybe it wasn't so clear. And maybe as we go into the elections next time, it will be clearer. Your MCA determines more about your life, perhaps, than your MP does, with all due respect, perhaps even than your senator does, or your governor. Because if your MCA says, we shall buy curtains for 7 million shillings, they will be bought. If your MCA says that we will use the same 7 million shillings to raise awareness about how we can prevent illness, or to create sanitation, then that is what is going to happen. So perhaps that's one thing that we can do, quite apart from the other things that you've taken this evening. I want to thank you so much for your time. I want to thank you for your patience. I want us to acknowledge the people who make this happen. First, to everyone on social media who has joined us. I know I didn't read every single one of these, but I certainly hope that your questions were answered.